Okay, so I want to thank Dave and his company for coming. They're going to talk to us today about cybersecurity and healthcare. So I guess some effective strategies to mitigate risks for your company. Dave has over 20 years experience in the technology industry, including nearly 16 years currently with ACT. He has held various leadership roles in the areas of business development, operations, strategic planning, and implementation. He is deeply passionate about regional business community and is dedicated to ensuring that businesses in Connecticut, such as all of us in this group, which is why you're here, have access to cost-effective, secure technological solutions that empower growth and innovations. Originally from Massachusetts, David has been in Connecticut for 2 decades. He currently resides in Southport with his wife and 2 children, a cat, and an exceptionally cool dog. So what kind of dog is it?
He's Boston Terrier.
Boston Terrier. Outside of his professional endeavors, he's an avid supporter of the Boston sports team.
Yeah.
So welcome and thank you so much
For having me. Before I get started, thank you to Laura for the invite and to the council for having me today. And I also wanted to thank Jenna Brown. Jen is our marketing coordinator, and she put all of this together today. She's really the glue that holds our company together when it comes to these type of events. I also will say that it was my intention to bring a 62 slide deck. And Jenna said, no. Because if you bring that, you're gonna have to bring boxes of coffee for the group. Thank you so much, Jenna, for putting this together today for us. And thank you everyone for attending. So as Deborah had mentioned, we're going to discuss cybersecurity and healthcare effective strategies to mitigate risk for your respective practice and your businesses. So a couple things that we're going to talk about today are stats and trends, what we're seeing in the industry, common attack types, use cases, consequences, importance of sound cybersecurity, preventative measures, and what we can all do about it as individuals in our respective organizations, whether you're an IT person or an executive, like practical things you can do. And then we're going to open it up for Q&A if anybody has any questions following.
Dave, not to interrupt you,
Sure.
just watch your back, because I think that's sensor controlled and it keeps dripping out water every
Is that
time.
when my elbows wet?
Yes.
Yeah. Thank you for that.
Have a
I
shower
appreciate
first.
that. I'm like. All right, so here's some interesting trends that we've been privy to here. And as you can see, this is healthcare data breaches of 500 plus records. And we've had over 703 reports in 2024. So that's 703 organizations, healthcare organizations that have reported a data breach of 500 plus records. Now, you can see it's plateauing out, which you'd think is a good thing, but it's really not, because our security is getting better. It's improving. So it says to me that although our security is improving, the bad guys are still staying ahead of the curve and amping up those attacks. What's important to note on the next slide is that those attacks have affected nearly 190 million Americans. So 190 million Americans had their names, their date of birth, their phone numbers, their social security numbers exposed in healthcare related data breaches in 2024. Anybody have any idea what the United States population is today? Anyone?
70 million.
Pretty close, 340 million. So that's 53%. So a little over 1 out of every 2 Americans was affected in data breach. So in this room today, probably about 12 or 13 people. So a significant number. So what that tells me is that bad guys are getting a little bit more targeted in their attacks. They're moving up market because they realize that this industry is very, very lucrative. But it doesn't just mean that they're going after the big guys. They're also going after the small practices too. Next slide. So some common types of attacks: ransomware attacks, phishing and social engineering attacks, and insider threats. Anybody have an idea as to what a ransomware attack is? Will? Thank you for raising your hand.
We need more coffee. More coffee.
So they'll get into and get your database, and then someone typically gets a call or contacted and gives the ultimatum. We can expose you, or you can send these funds to this place, and it won't happen. So it really just puts a lot of people on the spot. And I think that's more common than people might think, actually, because a lot of times the last thing they want is it to become public knowledge. So when I think about it, I'm like, for every 10 you hear, there was probably like 15 more that
Right.
someone just complied.
I have
Good
my cousin.
explanation. The long and short is a ransomware attack is an intentional attack by an individual, right? And the purpose is to get some sort of financial payment for data that's been encrypted or stolen. They'll give it back. Sometimes they do, sometimes they don't. Anybody have an idea what a phishing or social engineering attack is? Like phishing, what phishing is?
When.
Oh, this is for you, Will. Sorry.
I was eyeballing you like, where's my prize?
To kind of click and it sends you through not to a site that's authentic so that they can gain information.
What are you giving them?
Generally,
Yeah.
you're giving them personal information.
Don't do that.
Yeah.
So yes, you're giving them personal information, right? So a username and a password, they'll send you to a site that looks like a Microsoft login page, something you're very familiar with. You put in your username and password, they get an alert on the back end. Next thing you know, they're logging into your Microsoft 365 account and they're looking around. So not a good thing. Don't. Okay, good. And then insider threats. These can be both intentional and unintentional, right? And this is a tough one to maintain because sometimes we think we're doing the right thing, but we're not. And then other times where we may have a bad actor in our environment that is doing something malicious in our organization. So this is an interesting part, insider threats, because we believe we have the right people in our organizations and it's very likely that we do, but there are situations where somebody may do something inadvertently and it causes some havoc. All of these attacks have the intention of disrupting business and operations and in some way, shape or form, creating some financial gain for a bad person, criminal. Next slide. So use case, we're going to talk about a couple of organizations that may hit home here. One is a community health center in Middletown, Connecticut. They're a regional health center. I want to say they have like 13 or 14 clinics here in Connecticut. Really good organization. It's been around since the 50s. They serve a lot of patients and they just recently had a breach. We'll talk about that breach in a little bit. And another one is Ryders Health Management, family-owned business, 8 locations here in Connecticut. Again, been serving the community for a long time, skilled nursing facility. They help people. Both of these organizations help people, and they were both victim of breaches. So we'll go into these specific use cases. All right, so community health center. This is an interesting one. It's been all over the news lately. It's still being investigated. It was a skilled criminal breach that stole protected health information. So all of the good stuff, names, social security numbers, phone numbers, everything. All right, none of it was encrypted. There was no ransom, but the data was exfiltrated. So somebody took it, they have evidence that data was taken. The question is, what are they gonna do with it? What are they gonna do with it? Somebody's got over 1 million names, social security numbers in their possession that they could do bad things with. The interesting thing about this is that although community health center is a regional player in the market, this breach affected 18 different states. So not only are they gonna have to deal with the Department of Health and Human Services, OCR, in filing claims, but they've got 18 AGs that have already filed suit. So it's gonna be a pretty tough remediative process for them. I'm not saying that it could have been something that could have been prevented, but it's definitely gonna be a tough go for the community health center. So everything is still in progress and more details will come as a result of it. But they just know that somebody was in the environment, somebody exfiltrated data, and it was a lot of data. Next slide.
And I'm wondering if, they did a lot of COVID testing, because I had 3 letters at home from them, so
Yes.
I'm thinking like all of those people, like even the drive-through COVID test,
Yes.
when there was hundreds of people in line. I mean, they must have had just so many records, even from those simple
Correct.
transactions, yeah.
A lot of that. So Ryders Health Management was an attack that actually happened in 2023, and this was a little different because it was a ransomware attack. The Ryders IT team had identified that there was a ransomware-based tools in their environment. They tried to stop that access, but there was over 7,400 records that were leaked and encrypted. They were encrypted and they were also removed. So, a double whammy, so to speak. Things were encrypted and removed. So when it's encrypted, you can't use them. So think about what that would mean for your practices. tomorrow you walked into work and all of a sudden you had a line full of patients there and you had no records or charts on them. You didn't know what you've done for them in the last month. It can be really detrimental to our approach to serve and support our communities. So this one here is kind of still in progress in terms of the remediative efforts as well. I think Ryders has taken a responsible stance in shoring up, their cybersecurity posture, but not only that, offering complimentary credit protection, monitoring for everybody affected. But again, something that it can be prevented, why not? Next slide. So consequences. Those two slides talk about data being leaked, right? And it stinks when it goes someplace else or it's encrypted. But how does that impact our patient care, right? We talk about charts, medical treatments, the disruption that can cause, me getting an adjustment, or Jenna going to get treatment for some ailment that she has. It has a direct impact on patient outcomes. So we need to be mindful of that. This piece about reputational damage, you have to notify all of your patients that something has happened if it has happened. And that, I think, in a lot of regards has caused a lot of uncertainty with treatment. If my provider can't, keep my privacy intact, how are they going to support me as an individual to make sure that I'm a healthy, member of this community? So that has happened. It's been a decay. Legal and regulatory repercussions. This is getting to be a big one. And the Department of Health and Human Services has caps on punitive damages or penalties that they can assess. I think it's to the tune of about $2.4 million per breach these days. But the state of Connecticut also allows for civil and criminal penalties if they determine that there is negligence in a situation. So all not fun stuff to deal with. And then there's the part about doing the right thing and making sure that your patients are protected after an event, doing what you can do to make sure that their identities are intact and safe. So that is that piece. The long-term financial implications, what I've seen post-breach in situations is that companies typically go nuclear in their approach to cybersecurity, and they will go to significant lengths to protect every particular vertice that they can in protecting themselves. So they spend a lot of money not only on the remediative efforts, but then also on protecting, their organizations going forward. So it's a very costly endeavor. So it really can take years to recover from. So that's all the bad stuff, right? So why is it important? We want to keep our patients safe. We want to keep our communications safe, our communities safe. According to HIPAA, the three biggest things we need the three tenets are: we got to keep our data private, we got to keep it protected, and if we're not doing either of those two things, we got to report it. So we want to maintain confidentiality and trust with our patients, and then we want to make sure that we're complying with regulatory laws and doing the right thing by that tenet as well. Jim? So preventative measures, right? Do we have any IT people in here? No, kind of, sort of. I'm not giving you another one of these. Forget it.
Nope. Fine.
Give you one, Dr. J. Dr. J. Let's see how good shot. So preventative measures, right? This first one is
No problem.
a technology piece, right? And implementing strong access controls. Some people say things about zero trust. It's like, trust no one, give them access to the things that they need as they request them. I'm a firm believer in having strong passwords, right? So strong passwords, it's got to be at least 37 characters. I'm just kidding. But having strong passwords is important. And some of us are in very large organizations like Griffin, where your IT team says, you need to have this strong password.
15 characters.
Really?
Wow. 2 to 3 months, depending on
Okay.
what site you were on.
You sound like you really
Give
did
this to
that.
your IT guy, he's doing a great job. So that's great, right? So some of us have corporate IT teams that will enforce these policies. Not all of us have that luxury, right? But it's important. Okay, then when we go back to our respective offices and we talk about this, Because there are tools that can actually mine for passwords, that can try to crack them. And the more complex they are, the better, and the more frequently you change them, the better, okay? So if nothing more, please take that back with you. The other piece is multi-factor authentication, right? We talk a lot about multi-factor authentication, and does anybody know what that is?
That's that two-step one, right?
Yes.
Two-step, right? So it could be like a code, or it could be like a red button, green button. Okay, multi-factor authentication is really, really important in this day and age. Cause it's not good enough to just have a username and password, but have something else to validate that it is actually you. We can get into other things like, retina scans and all that other stuff, but for now, MFA is a good piece to have. The next piece is regular security assessments and audits. If you're an owner, founder, an operator, I think you owe it to yourself to have a checkup once a year, much like I go in and have a physical, right? Hey, where am I at? Let's get a benchmark. What can we improve? Things are changing in healthcare as they are in technology. So regular security assessments could be like a vulnerability assessment, a very simple risk assessment, a penetration test, which is having an industry professional take a look at where you're at from a technology perspective, giving you some recommendations, and then making a choice as to whether or not you want to act on them. So that's an important one. Advanced threat detection systems. Can anybody here give me an example like what it's really fancy for, protection? Anyone? Advanced threat protection system?
I feel like I should know.
Are we overthinking it?
Like,
Yeah.
Yeah.
on our email, like, it has a little thing,
Yeah.
if you think it's like maybe phishing that you hit it and it'll check it for you.
Awesome, okay. Yeah, so that's like mail security. Yeah, mail security is a good one.
Is it like a McAfee, like you have?
There it is.
Oh, okay.
Very simple, antivirus, endpoint detection and response. Some of these may be things that your IT team employs or your managed service provider. If you're a small business, you get 3 or 4 people, you just want to make sure that you have base level protection, endpoint protection, maybe a firewall, multi-factor authentication, real simple security measures that can minimize your chances of these bad things happening. Okay, so that's advanced threat detection systems. Next up is encrypt sensitive data always. Always, always, always. Always. If there's patient data that sits in your environment or is moving out of your environment and going someplace else, encrypt it. Just encrypt it. A lot of these attacks we talked about, that 703, there were various organizations that were affected in that process, but some of those breaches happened downstream. So it might have been, Griffin Hospital, okay, sending an email to you, Dr. J, right? Unencrypted, your email was compromised. The attack happened to you, but it affected their patient data. Everybody's in trouble, right? So that's a big part of things. So making sure that data is encrypted in transit and at rest, and that there's responsibility and stewardship of that data.
We used to have a secure email site, but then recently when we merged, all we have to write is the word confidential in the subject line. As soon as we do that,
And Chris,
it encrypts it automatically, no matter where you're sending. it. So like 5 words we can, in there.
isn't that awesome?
Yeah.
It is, you gotta remember, right?
It makes it a little easier than signing on to a different site and.
Yeah. I'm really glad you brought that up. We'll get to that in a minute, but that's really good point. I'm glad we brought it up.
It gets a squishy ball.
Oh. I don't wanna make you spill your
Well,
coffee.
I only have one, I put my elbows.
It's silver coffee.
Okay, the last piece here is regular security and awareness training, right? A lot of this has to be governed by the entity or organization. Like it is the most important and most cost-effective tool that you can use to protect your organizations today. I believe that, well, it's true. I mean, see that, water will find the smallest crack, as will, would-be attacker. The most exploited vector that we have in our industry is people, right? People make mistakes, and people make mistakes. They're tricked into phishing schemes and attacks. They press the wrong button, hit the wrong link. So just investing in some sort of security and awareness training for your employees is really important and will help you be more vigilant in your approach to protecting your businesses, your clients, and your data. So they're very simple tools. I mean, some cost as low as like $25 a month for a full staff. It's not expensive. Others are like a couple of dollars per user per month. There's a lot of different plans and products in the market. Highly recommend, you have regular security and awareness training. Okay, so this is like the 13th slide. We would have been on like slide 13 of 62 right now. Yeah.
Thank you, Jen.
Yeah.
Nice way to streamline.
Yes, yeah, get right to the point. So be vigilant, being vigilant is important. If your cybersecurity is not governed by corporate policy, change your passwords, make sure that you have character complexity, right? Share that you're doing that with your teammates, so lead by example, let them know that you're doing the right things, and maybe they should too. I'd also say that if it doesn't feel right, it's probably not right. If you've got an email that's sitting on your desktop and it looks a little suspicious, it probably is, and anytime you look at that hyperlink that's in an email, just ask yourself, what could potentially happen if I do click this because I don't recognize the sender? Or if there is a splash screen that comes up that's from Microsoft or QuickBooks or any of those entities, like, do I really need to put my username and password in this? Check the hyperlink. Be vigilant. So important. Promote awareness with your teams, with your organizations in this council and in every council that you're part of, promote security awareness and just doing the right thing when you have the opportunity to do the right thing. And foster a security focused culture, right? We don't want to make IT our primary business in IT security, but we got to be aware of it and we got to be focused on what's going on out there in the marketplace. And the last piece, to Deborah's point, things are changing. Things are changing. Like that complicated effort that it used to take to encrypt an email is now confidential. So embrace innovation. And if you have the opportunity to learn a little bit more about, something that's in a related industry that could help your business, your practice, your day-to-day operation and life, you'd like to do it, please. Almost like. Okay, Meredith. Thank you, everybody, for having me today. Really appreciate it. Before we wrap up, though, I think Jenna had a trivia question.
Oh, does anybody know what HIPAA stands for?
I'll let someone know, because I teach.
Yeah, and I work in health.
Health Insurance Portability and Accountability Act.
Watch your shoulder or watch your arm.
Is it? Is that right, Dave?
That's right.
That's right.
Yes, who's that?
It's Neil at Comfort Care. Hi.
Neil, congratulations. You've got a goodie bag, compliments of Jenna. We'll leave it here for you at the chamber.
Oh, really? Oh, I wasn't expecting that. Okay, thank you.
Glad you keep your expectations low, Neil. Thank you so much. So again, thank you everybody for having us today. Does anybody have any questions? Well,
And it's just something that, actually, I would love to get your opinion on it when it comes to like the softwares, right? Like the antivirus softwares. I've been hearing this and it seems like even some of the younger gamers are just like, there's like, I keep hearing some people actually are saying like, oh, it doesn't really matter. It doesn't really do that much. So when you look at like the Nortons or the McCat, like what do you think is like the best? Is there one that stands out, or is there something that people can use outside of just those ones that everyone knows about, that's a better one to use for that kind of like blocking and antivirus?
It's a really good question.
it's a great question. And to the first statement is it matters.
Yeah.
It matters. And it's kind of funny, we're having a use case with AI in our office the other day, and it's like, you use AI for all these cool things, and our whole thing is that like AI will get us 80% of the way there with a piece of content we generate, to brush it up. Like a basic AV platform will block 80 to 85% of anything that is malicious coming in. So long as it's installed and you're updating it, right? Got to update it. I'm partial to more commercial grade products like SentinelOne and CrowdStrike. Those are two names that people are familiar with. They do a real good job at doing their job, and they share intelligence among a very robust community. So they're really good at staying ahead of attacks. and keeping us safe and protected on that end. And some of those companies are actually moving more into the consumer markets too. So they're offering more affordable options that are scalable for individuals. But to your point, it matters. Gotta have one, right? On your home PC, your business PC, like whatever it is, you gotta have some sort of awesome question.
Harold does have a question.
Harold.
Yeah, well, first of all, thank you for a terrific presentation. And it's such an important area. It affects everybody. A question for you is really just a trending question. Do you find no matter how hard you work at this, there's always something that happens? It's, they work on it every day. Do you see an enormous trend in increasing in cyber security insurance? Because I know a lot of companies are putting more and more in their budget to do that. And do you see that being accessed? Just if you give us a little overview on that. It's an insurance question, but maybe you have some sense of trend.
Yeah. So that's an awesome, again, a very good topic, and one that you can give a whole presentation on cyber liability insurance. 3 years ago, when it started becoming a little bit more of a topic outside of just a general liability policy, cyber liability was kind of loose and fast. Insurance companies were writing policies, people were making claims, and insurance companies were paying out quite a bit. What we found is the insurance companies are getting more specific in the line of questions that they ask and what they request of a policyholder. So most of their questions and their applications align with recognized cybersecurity frameworks. So you really need to make sure that you're meeting a certain level of control in your environment before they'll write you a policy. On the backside of that, when you do have an incident or there is a need for a response, they're now going back to that policy questionnaire and making sure that the incident is not in direct alignment or conflict with what you answered on your questionnaire. So those are two things that you really need to be conscientious of. And I've seen a couple situations where people have answered on their questionnaire, I have multi-factor authentication in my environment. And they did have multi-factor authentication in their environment. But they did not have multi-factor authentication in their environment on a server that had remote access that held patient data. And that server was breached. And so the insurance company was not willing to pay the claim from the entire scenario situation. So that's kind of the bad part of it. It is becoming more and more of a topic of conversation. Insurance companies are leveraging third parties that have APIs that will actually sync in environments and run simulated attacks to see how the environment responds. So Harold, I think I went a little bit overboard in answering your question, but did I?
No, it's terrific. It's really an insurance question, but I mean, you're in the business, so I just was curious.
Yeah.
I think all companies, I know my company, we're all focused on that and putting some concrete behind it to make sure that we're all covered, because it's so hard to nail all the issues that can happen within a company. And everybody on this call is dealing with arguably sensitive documentation or sensitive information. So it's all something that we all have to think about.
I personally have a cyber liability policy, and I'll say that just because one has a cyber liability policy doesn't mean that it makes so that they don't have to do the right things. You still have to have firewall, antivirus, good passwords, all that other good stuff, because that is really becoming a contingency on you having a policy and actually being able to process a claim if something bad happens.
Nancy had a question.
Hey, Nancy.
Hi. I have a quick question. I do ask this actually in our TIDE Council, which is our technology council meetings on occasion. Password managers, especially for, I know with a Griffin, it probably wouldn't necessarily work, but for a small organization like us, is that worth it to have password managers? So you don't have to help.
So it's a good question. I think it will have a unique answer based on the organization. I personally am a fan of password managers. I think it's a lot better than the stickies under the laptops and,
Yeah.
the things that are written in different places. I think it's it's a better way to house that information. The other piece about password management tools, if you're in a larger organization or in a company, and let's just say something happens to somebody. I recently had an organization where somebody passed away. And it was such like an anxiety-ridden situation. But that person had access to a lot of privileged information, a lot of sensitive information, applications and systems. And the ownership group didn't know where to start. So if there was a password management tool in place, that management team could have come in and just taken care of things really, really quickly and made sure that they had access to all the things that they needed to. So Nancy, I'm not saying you're going away anytime soon, but thumbs up to password management tools.
I don't know if it's something that they purchase through you or how this happens or if organizations do it themselves, but where I am, we get tests. So they send us one of those phishing things
Yeah.
Yes.
and they find out which employees click on it. And once you do it, it says, take a test. And then you go through an entire cybersecurity education
There it is.
before you can use IT.
Well, that's a hard word.
Yeah, so it's not a long thing, but we just recently merged and we have a lot bigger IT and she's like, what did I do? Now I have to take a test. And I'm like, I don't know. I had to call IT and they're like, well, you clicked on something. So if you don't click the little button that you talked about, but we have a little fish hook that we click and we report something and then they get back to you within like 2 minutes. But if you don't click that and you click it and you open it,
That's a great takeaway.
and it's the company sending it.
Yeah.
The carrot or the stick, right?
Yeah.
The carrot or stick. We actually have companies that employ security awareness training and they do like a phishing simulation attacks. They want to test their employees to see how things fare.
Yeah.
And they actually will part the groups up and it'll be like team A versus team B. And they'll let them know like, hey, this quarter, we're gonna have 2 or 3 phishing simulations. We're gonna see how you perform. And then like the winner gets a pizza party, the other team has to serve them. So it's kind of, fun stuff.
But you said make sure you're always doing checks and balances and
Checks
things
and
like that. I'm
balances,
guessing
yeah.
that's why they do
Check and balance,
it.
absolutely. Yeah, that's the efficacy. Yeah.
Well, thank you.
Yeah.